Good evening, everyone. Am I audible to you all? Okay. So today we are discussing our NEET MDS 2023 question paper from the memory-based questions which we collected from our students. Okay. So we have already had one part of it, part 1. Yesterday Dr. Monisha had dealt with a few of the questions. Today I'll be taking the memory-based recall part 2. Before that, congratulations to all those students who have secured a very good rank for NEET MDS 2022, and the rest of you all, please do not be disheartened. Okay, take a break, relax, and then start preparing for INI-CET, the upcoming INI-CET. So we'll be coming up with the strategies, how to go about the preparation and how to prepare for the upcoming May 2023 INI-CET. So stay tuned for that. Today now we shall go ahead with our question paper. So the first question, it's an image based question. Okay, what do you see here is over here you can see the calcification of a particular region. Can anyone tell what it is? Calcification of falx cerebri is seen in the picture. Okay, so it's a distinctive lamellar calcification noted in the anteroposterior skull film. Okay, so it's a highly consistent finding with a particular type of syndrome. The syndrome is nevoid basal cell carcinoma syndrome, or other names for the syndrome include Gorlin-Gall syndrome, basal neval cell syndrome, and nevoid basal cell carcinoma syndrome. Okay, and different parameters or symptoms or signs included in basal cell carcinoma syndrome is, you can see in the first picture there are multiple cysts, multiple jaw cysts, which is odontogenic keratocyst. Okay, that is one particular finding. And in the second picture, what do you see is a bifid rib. Okay, bifid rib or a splayed rib. This is also one of the particular feature of this Gorlin syndrome. And the last one you see was asked for the exam, that was calcification of falx cerebri. Okay, so there are these skeletal anomalies along with the multiple jaw cysts that is seen in Gorlin syndrome. Other skeletal anomalies includes kyphoscoliosis and fusion of vertebral borders. Okay, moving ahead with the second question. Oral hairy leukoplakia is caused by, okay, it's caused by a particular virus. We shall go and check the answer. It's Epstein-Barr virus. Okay, Epstein-Barr virus is a type of herpes virus. This is how oral hairy leukoplakia looks like. It is the second most common oral lesion associated with HIV or AIDS. Okay, and the first common is being oral candidiasis. This appears as bilateral white striae, including on the ventral surface of the tongue. Okay, as you can see in the picture, and it gives a corrugated appearance. That's why the term oral hairy leukoplakia. Okay, now about the Epstein-Barr virus. It is one of the herpes virus. Again, herpes virus, we have 8 different types of herpes virus: HHV 1, 2, 3, 4, 5, 6, 7 and 8. Herpes simplex virus 1, which causes above waist infections, and HHV 2 causes below waist, right? So you are all familiar with that. And the third HHV, which is also known as varicella zoster virus, this causes your chicken pox and shingles. You all are aware of chicken pox, so that virus which is causing chicken pox is also an HHV, that is HHV 3. And the fourth one is cytomegalovirus, Fifth HHV is our Epstein-Barr virus, which causes hairy leukoplakia. The other infections associated with HHV5 or Epstein-Barr virus are infectious mononucleosis and encephalitis. Okay. Let's go ahead with the next question. This one is from maxillofacial surgery. It is from multiple extractions point of view. Okay. Stobie's extraction is done using which elevator? That was the question. Again, you all must be wondering, what is Stobie's extraction? Let's check it out. It is done using straight elevator. Okay. Now, how do you do Stobie's extraction, or what do you mean by Stobie's extraction? It is while extracting multiple mandibular teeth, as you can see in the picture, a straight elevator is used in between the teeth to luxate the teeth. Okay, so when you insert an elevator in between the tooth and then you rotate it, this movement causes the luxation of both the teeth, right? So it aids in multiple anterior, lower anterior extractions. The other multiple extractions include balancing extraction, compensating extraction, then you have driftodontics, all serial extractions, Wilkinson extractions and all these were included in the options, I guess. Okay. Going ahead with the next question. What do you see here? It was a histopathologic image. It was an image-based question with some history, I think. So, the child reported with episodes of hypoxia and low hemoglobin count. And on the histopathology, a certain particular type of RBCs are seen in that picture, right? What is that? It is sickle cells, okay. Sickle cell anemia is the disease. Now, what is sickle cell anemia? It is one of the hemoglobinopathies, okay. What are hemoglobinopathies? They are certain hereditary diseases which are inherited mutations which will lead to certain defect in the hemoglobin, the structure of hemoglobin, okay. Now, the lab findings of sickle cell anemia include a reduced RBC count, sometimes less than 1 lakh, and then a reduced hemoglobin count as well. And the blood smear, on the blood smear, the RBCs have this particular shape, sickle shaped RBCs are seen. Okay, that's how you diagnose sickle cell anemia. Moving ahead with the next question. Again, another image based question. It was from pedodontics. Okay, you all are aware of the experiment, right? The dog and bell experiment. Okay, it is also known as Pavlov's experiment, right? Done by Ivan Pavlov. Now, what is this experiment, or what behavioral theory is it based on? The answer is classical conditioning theory. When first you are given food was given to the dog, and in response, the unconditioned response is salivation. Then along with the food, a bell was rang, right? So it becomes an unconditioned response. Then later on, when the food was removed and the bell was rang, salivation was seen in the dog. So that then the bell became a conditioned stimulus. Earlier it was a neutral stimulus. Then after conditioning along with the food, it became a conditioned stimulus. This is one of the behavioral theory in psychology, okay, child psychology as well. The other theory is operant conditioning. And one of the other example of classical conditioning theory in our clinical setup or dental clinic or in a hospital is that when a child sees a doctor in the first visit, they see the white coat, that is a neutral stimulus in the first visit. Then they get an injection, and due to the fear and the response, they fear of it, and then they start crying. On the second visit, the lab coat, which was a neutral stimulus in the first visit, it becomes a conditioned stimulus. And upon seeing the lab coat itself, a child starts crying. So this is another example of classical conditioning theory. Okay. The next question is from conservative dentistry. It's about an instrument, right? Angle former is a type of either chisel or excavator, or that was given as options, I think. So I'll show you the picture as well. It is a special type of excavator. Angle former is a special type of excavator used for sharpening the line angles and creating retentive features in dentin for gold restorations. Apart from usage in gold restorations, it is also used for placing bevel on the enamel margins. Okay. And this particular instrument, as you can see in the picture, it is mono-angled, right? And it is at a different angle other than 90 degree to the handle. Okay. So that's how you, even if you get an image based question about angle former, that's how you identify it. Moving ahead with the next question. Penicillamine is an antidote for. So where is penicillamine used? What is it? It is a chelating agent. Now what does it chelate? It chelates copper. Okay. So it's an antidote for copper. Now when do you need an antidote for copper? When do you have extra copper accumulation in your body? This is the disease which we are treating. So to treat Wilson's disease, penicillamine is used. In Wilson's disease, what happens is there is extra copper accumulation throughout the body, especially in the liver, the brain and other vital organs. So to remove that excess copper, we use penicillamine as a chelating agent. A particular characteristic of Wilson's disease or extra copper accumulation. As you can see in the picture, there is a pigmented ring which is seen in the sclerocorneal junction, right? A golden brown or greenish yellow in color, and this is due to deposition of copper in the Descemet's membrane. Okay. So this is another particular feature of liver diseases as well as Wilson's disease. As it's written, this particular symptom is present in 98% with neurological involvement and in 50% of patients with hepatic involvement as well. So you can get an image based question from this as well. Kayser-Fleischer rings. Next is a direct pick. Very easy question. Duct of submandibular salivary gland. What is a duct? Wharton's duct, right? Simple question. The next one, again a direct pick. If you are thorough about your basics, you will never go wrong with this question. Okay, how is the first number in a 4-number instrument formula denoted? First of all, you should know what are the 4 numbers and what is it meant for. Okay, let's check it out. The first number denotes the width of the blade. Okay, and the width of the blade, how do you denote? It is not in millimeters. It is measured as in terms of 1/10 of millimeter. Okay, so the first number is width of the instrument in 1/10 of millimeter. And the second one, as you can see here, this is the second number which is cutting edge angle. Okay, now what is it? It is the angle formed by the cutting edge and the long axis of the instrument in a clockwise direction, which is measured not in degrees. Remember, it is measured in centigrades. Okay, so that is the second number. And then you have third number, as it is written there. Third number is blade length, and the fourth is again another angle, that is the blade angle. Okay, the next question, it's from community dentistry. In an epidemiological study, the first case that comes to the investigator is known as. So there is a difference between first case coming to the investigator and the actual first case. Okay. So the one which is noted by the community health worker when there is a contagious disease spreading in a particular area. The first case which is noted by the health worker is the index case. Okay. The other options were, I think, primary case, secondary case, reference case and all. So the answer here is index case. And the primary case is the first actual case reported of that disease. And the secondary case is a person getting infected from the primary case, that is termed as secondary case. Okay. So that's how it is. Moving ahead. A question from physiology. The first hard sound is due to. We have 4 hard sounds, right? So the first hard sound, it is due to the concomitant closure of tricuspid and the mitral valve. Okay. Let's check it out. The 4 hard sounds. The first one is the first and the second are audible using a stethoscope. We term it as lub dub, right? The first hard sound is lub and second is dub. The first one is caused by the closure of the atrioventricular valves, and the second one is caused by the closure of the semilunar valves. And the third one and fourth one, which are not audible much, which is much of a feeble voice. So it is linked with the flow of the blood into the ventricles. And the fourth hard sound is due to the atrial contraction. Sorry. Now the next question is from Prostho, right? The type of pontic indicated in recently extracted socket. So what is the answer for that? Ovate pontic. Let's see how it looks like. See, this is the most aesthetically appealing pontic design, right? So it has got a convex surface. The tissue surface is convex and it is fitting nicely into that extraction socket, and it gives a very aesthetic appearance, that as if the tooth is emerging from the gingiva or from the socket. That appearance is seen with ovate pontic. So that is the type of pontic indicated in a recently extracted socket. The next one, I think it was either an image based question or a history based question. Anyways, I've given both. A newborn baby with ulcers on the tongue. You can see ulcers on the ventral surface of the tongue in the image, right? And it is, so there is teeth, mandibular centrals are emerged there. There is natal teeth. So the most common complication which is associated with natal teeth is Riga-Fede disease. Okay. So even though the term is a bit complicated, don't worry, it is named after the people who have diagnosed it first. Okay, Riga and Fede. So that is Riga-Fede disease. It's nothing. The mandibular, when there is presence of natal teeth, it causes ulceration in the ventral surface of the tongue, as you can see here. Also the frenula. This can give infection as well as fever associated problems for an infant. So this particular condition is termed as Riga-Fede disease. Okay. Now how do you treat it? You have to actually take a radiograph and see if it's actually primary incisors or how much is the root formation. And also clinically, if it's mobile, there is a chance of aspiration. So it has to be, if it's mobile, it has to be removed. Or else if it's causing much of a trouble, if it's very sharp and all, you'll have to grind it and smoothen it out. Okay. Next question. It's from conservative dentistry. It's again a direct pick. Okay. If you know your basics thoroughly, you will, there were many questions like this, okay, direct picks. When you know your basics, you will be able to write the answer very well. I mean, there is no confusion about this, right? Kim's Isthmus classification type 3. Let's go ahead and see the answer. It's very short, complete isthmus between two canals. So let's see how is it classified. Okay. So type 1, type 2, type 3 and type 4 is there. So in the type 2 you can see there a complete isthmus with a definite connection between two canals, and then you have 3, 4 and 5. You can go ahead and check it out. Moving on to the next question. It's an image based question, okay. This particular image is given and you are asked to identify what it is. So many colors are there. So what is that? It's a popular system for the visual determination of color. There are parameters represented in 3 dimensions, multiple colors, and the parameters are value, chroma and hue, right? What is the system? It's Munsell system, okay? Again an easy question. The last one in today's discussion. 4 near molars are associated with, okay? What are they? Hutchinson's incisors are also associated with the same disease. What is it? Congenital syphilis, okay? Now, how does 4 near molars looks like? So, you can see in the picture the molars are hypoplastic and there are so many cusps, right? That's why it is also termed as mulberry molars or moon's molars, this particular appearance. And then Hutchinson's incisors are also associated with congenital syphilis, which is like you have a notch in your central incisors. That is the particular appearance. Now, how do you get this problem? First of all, syphilis, it's a sexually transmitted disease. So, when the mother has syphilis, at the 5th month, this Treponema pallidum, it crosses the placenta and it causes dental defects in the newborn baby, okay? The dental defects include all these Hutchinson's incisors, congenital syphilis, mulberry molars and all, okay? So that's it with today's discussion. So we'll be coming up with more case-based scenarios discussion as well. And at the end of our series, the memory-based recall series, we'll be putting up a document of all the questions and answers and also the keywords, whichever we couldn't find out the exact question, we'll put up the keyword and we'll update a document along with it. So guys, please stay tuned and get updates from our channel so that you can get access to the document as well. Thank you everyone.